Medicare is one of the most confusing things that you have to deal with when you're turning 65.
Life can be so confusing.
If you choose the wrong plan, it could end up costing you untold amounts of money.
Money.
But the problem is that studying this stuff is really boring. Believe me, I've been doing it for years, and it takes forever. So in this video, I am going to cram every single part and plan of Medicare into a single short video so that you can learn everything you need to know as fast as possible. There's a lot to cover, so I'm going to speed through this, but I can promise you that this will be the most efficient YouTube video that you've watched on all the different parts of Medicare. So let's start with the 5 different parts and plans that you need to know about Medicare. First, there's Parts A and B, which make up original Medicare, Part C, which is the Medicare Advantage plan, Part D, which is the prescription drug plan, and finally, Medicare supplement plans known as Medigap plans. Now, you will not be signing up for everything on the list. In order to have all of your bases covered, you'll just need to make sure you have coverage for hospitals, medical, and prescription drugs, and you may find that in one plan or multiple plans, but we'll explain how that works. Now, people usually go down one of 2 routes to get this coverage. One, either you're enrolled in original Medicare and get a Medicare supplement plan and a Medicare prescription drug plan, or you go the second route, which is to enroll in a Medicare Part C plan, which is known as Medicare Advantage plan, that covers all of your gaps and also covers your prescription drugs in one plan. More on those 2 options in a moment, but you'll notice that either way, you have to enroll in original Medicare, which is Parts A and B, in order to qualify for the other plans. This is because original Medicare is the foundation of Medicare. And of the 5 parts we're talking about today, Medicare Parts A and B are the only 2 that are provided directly by the federal government. The other 3 are provided by insurance companies that work with Medicare. Okay, let's get into the details, starting with Medicare Part A. Medicare Part A is the branch of Medicare that takes care of all your hospital costs. So if you're admitted to the hospital, Medicare Part A will help pay for most of the bill. If you're admitted to a skilled nursing facility, that also falls under Medicare Part A. Now, when it comes to costs, most people can enroll in Medicare Part A at a 0 premium as long as they or their spouse has worked 40 quarters, which is 10 years. However, Medicare Part A won't cover 100% of your inpatient costs. You will have costs, there will be copays or coinsurance, and it will not cover 100% of the bill. So for example, Medicare Part A has a deductible, which is set at $1,632 for 2024, and it usually gets slightly higher every year. Aside from the deductible, there are also copays that you'll need to make on Medicare Part A, which you can see in this chart. Now you can see here that once you're admitted to the hospital and you have paid that $1,632 deductible, you won't have to pay anything else for the hospital for the first 60 days. However, days 61 through 90, you will need to make a $408 copay, and days 91 to 150, the copay goes up to $816 a day during these days, which are called lifetime reserve days. And after days 150, now you're responsible for 100% of the cost of your bill. Now, keep in mind that Medicare Part A is paying for the hospital and the facility and the staff, the nursing staff, the hospital bed, all those things, but is not covering the doctors that see you in the hospital. Those are covered under Part B. So even though Medicare Part A is covering the facility costs, it is not covering all of the doctor costs. Now, there is a similar structure if you stay in a skilled nursing facility, and Part A also helps cover hospice care as well. If you want more info on these, you can check out my Part A overview video. And when it comes to enrollment, most people should enroll during the initial enrollment period. This is the 7-month window that typically starts 3 months before your 65th birth month and ends 3 months after your 65th birth month. Most people should enroll during this time. However, there are a few specific enrollments for people in specific situations. You can find a full list of special enrollment periods on Medicare's official website. One example would be if you're still covered by your employer's health plan, and it's creditable coverage, meaning it's equal to Medicare, you could continue with that plan instead of enrolling in Medicare. All right, so that's it for Medicare Part A. Now let's take a look at Medicare Part B. Medicare Part B is the branch of Medicare that handles your outpatient medical costs. This typically includes things like visits to doctor's offices, medical equipment, diagnostic services, and a bunch of other outpatient costs. Now, don't be fooled by the word outpatient costs, because oftentimes you are inpatient in a hospital, but the doctor is not employed by the hospital, and so that may also be considered an outpatient cost because the doctor is coming into the hospital to treat you. So many doctors in the hospital will still charge you under Medicare Part B. Now, unlike Medicare Part A, most people have to pay a premium for Medicare Part B. The standard premium for 2024 is $174.70 a month, and that typically increases each year. But people with higher income or that are in higher income brackets may have to pay more. This is known as Medicare's Income-Related Monthly Adjustment Amount, IRMAA, or IRMA for short. And here's a quick look at the IRMA brackets for 2024. Now keep in mind that these numbers are taken from your tax return 2 years prior. That's the number that Medicare uses to adjust your Medicare Part B premium. Feel free to pause the video if you need a little more time to look at this chart. Now in terms of cost sharing, Medicare Part B also has a deductible. For 2024, the deductible is $240. And again, the way deductibles work is that this is the amount you have to spend out of pocket first before Medicare Part B and its coverage kicks in. Then, once you've met that deductible, most Medicare Part B items and services will be subject to a 20% coinsurance. That means that Medicare is going to pay 80% of the bill, while you'll be responsible for the remaining 20% of the bill. And just like Medicare Part A, most people should enroll during the initial enrollment period, which is the same 7-month window around your 65th birthday that I just talked about. There are also some special enrollment periods for Medicare Part B. So for those who qualify, you may be able to enroll outside of that window around your 65th birthday. You can learn more about that on Medicare's website. Now, here's a little something extra that you need to know about Medicare Part B. If you miss your initial enrollment period and you don't qualify for a special enrollment period or have other coverage during that time, you will get a permanent penalty on your Medicare Part B premium. You'll pay an additional 10% penalty on your premium every year that you delay. So if you delay for 2 years, you'll have an additional 20% added to your premium. If you delay 3 years, you'll have an additional 30% added to your premium, and so on. And this isn't a penalty that you can pay off or get rid of. You'll be forced to pay this as long as you have Medicare, which means for the rest of your life. That's why it's so important to know about your initial enrollment period leading up to your 65th birthday and enroll when you're supposed to. Okay, that's it for Original Medicare. Together, Medicare Part A and B should already cover around 80% of your healthcare costs. However, the problem with Original Medicare is that there is no cap on the remaining 20% that you're responsible for. So if you get sick and really need expensive treatment, you could end up spending $10,000 out of pocket or maybe even $100,000 out of pocket because there is no limit. And that's why we tell people, don't just enroll in Original Medicare. You need to pair that with additional coverage. Also keep in mind that Original Medicare does not cover your prescription medications, so you need to do something to go with Original Medicare. You'll need Original Medicare and a supplement or a Medicare Advantage plan. Both of these options are provided by insurance companies, but that's about where the similarities end. Very quickly, let me just jump in here and say that if you're finding this video helpful, please hit the like button. Doing this will help us reach more people and help them understand how the different parts of Medicare work. And if you want to learn more about Medicare in a way that's simple and easy to understand, you can watch more of my videos here. And we're going to release a bunch of new videos in the coming months, so stay tuned. All right, let's keep moving. Medicare Part C is called Medicare Advantage. And when you sign up for a Medicare Advantage plan, Medicare will give the responsibility to that insurance company to take care of your health care, and they'll also give that insurance company the money that they would have spent on you if you stayed on Original Medicare. Insurance companies then manage that money, and because they have a lot of experience managing healthcare costs, and they have network providers and contracts with doctors and hospitals that in many cases are below the cost of Original Medicare, they're able to offer benefits often at a lower price than Medicare. So Medicare Advantage plans can often be more affordable to many people. Now, when it comes to the coverage, Medicare Advantage plans are required to cover everything that is included in Medicare Part A and Part B. Since they're not standardized, they can offer a lot of benefits that Original Medicare does not include. You'll find that most Medicare Advantage plans already include prescription drug coverage, and you're actually not allowed to enroll in a standalone prescription drug plan if you have a Medicare Advantage plan. Medicare Advantage plans often include other benefits like dental, vision, hearing care, transportation, over-the-counter coverage, and other things like that. You may even find some plans that have gym memberships or allowances for groceries and utilities and many other benefits that can help people who have Medicare. Now, when you enroll in a Medicare Advantage plan, you don't have to worry about the Medicare Part A and Medicare Part D copays and deductibles anymore. You will still have to pay your Medicare Part B premium, but your plan will have its own system of deductibles and copays. Again, these plans are not standardized, so you'll find plans with a $0 monthly premium, and you may find plans with expensive monthly premiums. If we take on average, though, the national average is $18.50 for a Medicare Advantage plan, but most people who are enrolled in Medicare Advantage plans, the vast majority, are enrolled in a $0 premium Medicare Advantage plan. Now, for deductibles and copays, it's really up to your plan. But what you'll find is that a lot of Medicare Advantage plans partner up with local doctors and hospitals, and they form a network. And if you get healthcare within that plan's network, you'll find that copays and coinsurance are generally quite low. Lastly, Medicare Advantage plans also have a maximum out-of-pocket limit. This is the amount that once your out-of-pocket spending reaches it, your Medicare Advantage plan will cover your expenses for the rest of the year. Now, when it comes to which plan is the best fit for you, Medicare Advantage plans are typically location-based, so the plan available to you will depend on where you live. So if you ever need help finding and comparing plans in your area, you can always call or text us. The number here is on the screen. We are glad to assist you in helping you find the best plan and coverage for your area and for your needs. But now let's take a brief look at the pros and cons of a Medicare Advantage plan. First, a Medicare Advantage plan includes prescription drug coverage. It has a lot of other benefits, like it usually has lower premiums and a lower maximum out-of-pocket limit. The cons may be that it has a network of hospitals and doctors, and if your hospital or doctor is not in the network, then you can't go to them because you would have to pay out of pocket to see them. And finally, the last con may be prior authorizations to get certain treatments. All right, so now let's move to the other side and take a look at the Medicare Supplement plus prescription drug plan option. Medicare Supplement plans are also called Medigap plans. This is because they're designed to cover the gaps in original Medicare. Remember the deductibles and copays of original Medicare that I talked about earlier? Well, Medicare supplement plans are designed to cover some of these gaps, but they don't provide any additional benefits to original Medicare. They don't have prescription drug plans included, for example, so you'll need to enroll in a standalone prescription drug plan separately. Medicare supplement plans are standardized. There are 10 different plans available, and it doesn't matter which insurance company you get your plan from. They're all required to provide the same coverage as everyone else. Of these 10 plans, the most popular today is the Medicare Supplement Plan G, which covers 5 out of the 6 gaps in original Medicare. The Medigap Plan N, which is slightly cheaper, covers 4 out of the 6 gaps. Now, the cost of these plans depend on which type of plan you get and the plan provider, meaning the insurance company, and the location where you live. The average for a Medigap Plan G is somewhere around $150 a month for someone turning 65, but it can get a lot higher, and in some cases it may be lower, and it also may depend on your age. So $150 at 65 may not sound too bad, but it could increase to $300 when you're 85. When it comes to copays, Medicare supplement plans typically have fewer copays to make when comparing them to a Medicare Advantage plan, but that really depends on the type of plan that you're getting. The Medigap Plan G is the most popular plan today, and with that plan, you'll only have to pay the Medicare Part B deductible. Now, if you want to see me give a more in-depth comparison of the 2 most popular Medicare supplement plans, we do have a Medigap Plan G versus Medigap Plan N video on our channel that you can check out. So here's a quick look at the pros and cons of a Medicare supplement plan. Again, they're standardized and they don't have networks, so you can use these plans anywhere in the country. Any doctor that accepts original Medicare will accept this plan. And also, you don't have to renew your plan every year. As for the cons, Medicare supplement plans are typically more expensive than Medicare Advantage plans, especially on the monthly basis. You'll also have to enroll in a separate drug plan and maybe even a separate insurance plan to cover dental, vision, and hearing for you. Now, speaking of drug plans, one of the major cons of a Medicare supplement plan is that it doesn't have any prescription drug coverage included. And that's why if you're going down this route, you'll need to enroll in a separate prescription drug plan. These prescription drug plans are also known as Medicare Part D plans. Now, Medicare Part D is probably the most confusing and maybe most expensive part of Medicare, but let me quickly go over the basics for you here. So for Medicare Part D, it covers prescription drugs. Medicare requires that these plans cover at least 2 drugs for every therapeutic drug category, but otherwise the plans are free to choose which drugs they include in their formularies and which ones they exclude. These plans are location-based, and they also have networks of pharmacies. The plans available to you will depend on where you live, but generally you'll find that in terms of premiums, the average is around $35 a month. As for copays, you'll need to know about how Medicare Part D stages work. Now, in 2024, Medicare Part D plans have 4 different stages. They have the deductible stage, where you pay 100% of the cost, the initial coverage stage, where you make copays or coinsurance, the coverage gap or donut hole, where you have to pay at least 25% of the cost of your drugs, and that's going away at the end of 2024. And then they had catastrophic coverage, where you pay very little out of pocket or zero out of pocket after that. But in 2025 and beyond, they're getting rid of the donut hole. So the stages are going down to just the 3 stages: the deductible stage, the initial coverage stage, and then the catastrophic coverage stage. And there's a maximum out of pocket of $2,000 a year. Now let's circle back a bit and look at how much everything is going to cost you. We have a full breakdown video of Medicare's costs, which you can check out on our channel. But let's just summarize things for you here. In the video, we explain that if you are a healthy individual and you don't go to the hospital or take medications, in that case, your average total spend, if you choose a Medicare supplement plan and a prescription drug plan, is $4,312.80 a year. If you're having a bad year health-wise, the average Medigap Plan G plus Medicare Part D would put you at about $7,852.80 out of pocket in a year. On the other hand, if you have a Medicare Advantage plan and never get any healthcare services, your yearly spend will come out to roughly $2,318.40 a year. And if you need a lot of services, but you have a plan with a $4,000 maximum out-of-pocket limit, your total cost for the year would run up to about $6,318.40. Now again, these are example numbers based on the examples that we give in the other video. In reality, the exact costs are going to differ from person to person depending on the county that you live in, which plans are available in your area, and which health services that you seek out. And that's why, if you need help finding the best plan for you, you can call or text us at 877-360-6565. There is no cost to working with us. Literally, insurance companies pay us to support you and to be a representative for you and to provide education to you. And again, that comes at no cost. Now, other than that, I hope this video helps you understand all the different letters of Medicare and how they relate to each other. So thank you for watching, and I'll see you on the next video.